Okay, welcome to my YouTube channel, guys. My name is Dr. Achievement, and today I'll be telling you all you need to know about Parkinson disease. All right, stay tuned with the video to the end, and I'll explain the treatment protocols which are there, which you might need to follow, and the symptoms which you see in case you're suspecting it is a Parkinson disease case. So let's dive in straight right away. Parkinson disease, it is a brain disorder that causes intending or uncontrollable movements, all right, such as shaking, stiffness, and difficulty with balance and coordination. All right, so symptoms, let me read more. The most prominent signs and symptoms of Parkinson disease occurs when nerves cells in the basal ganglia, an area of the brain that controls the movement. Basal ganglia is an area in the brain which controls movement. All right, becomes impaired, and normally the nerve cells or the neurons produce an important brain chemical known as dopamine. All right, so when the neuron die or become impaired, they produce less dopamine. All right, which causes the movement problems associated with the disease. All right, if you get the point, they say when a like let's say when dopamine which is being produced in the basal ganglia of the brain is dead, then it affects the movement control of the body, which causes Parkinson disease. A kind of symptoms like shaking. What are the symptoms of Parkinson disease? You can see here the symptoms of Parkinson disease. You'll be having a movement disorder, all right, shaking. All right, you'll be having other symptoms are there like depression, because when you are not performing activities nicely, you'll be having depression. That is by the way, and you'll be having difficulty in breathing, in breathlessness, fatigue. That is due to the muscles neuron disorder, the nerve inhibition disorder. All right. So what else are there to be known? Okay, people with Parkinson disease also lose the nerve endings that produce non-epinephrine. Non-epinephrine, we're talking about the hormones produced by adrenal medulla. All right, adrenal medulla produce the epinephrine and non-epinephrine. All right, this epinephrine and non-epinephrine helps a lot in the especially when we talk about the human response to environment, like in aspect of, if we're talking about characteristics, guys, I don't want to go too far. All right, if we're talking about characteristics of living things, we will be talking about attitude, adaptation to environment, when the environment is not stable for us. Let's say, like, for example, the lion is chasing the sheep. The sheep sees the lion, know that he's going to be eaten. Guess what? There's an activation of what we call fight and flight mode, whereas the sheep will run away from the site of problem. So these hormones helps in that, and still yet they helps in exercises and etc. Guys, I don't want to go too far, but we're just talking about Parkinson disease. Okay, this is the disorder in production of dopamine. Either the dopamine cells are dead, or either the production is less, all right, compared to what it should be. What causes the movement problem is associated with the disease. Scientists still do not know what the cause of the neurons, what causes the neurons to die. All right, that point is just saying that. All right, I've spoke about the symptoms. You'll be having heart rates and increase, such as increased heart rates. You'll be having blood pressure. You'll be having loss of epinephrine, right, which helps in movement. You'll be having fatigue, irregular blood pressure. You'll be having decrease in movement. You're having food disorder, digestive tracts, etc. And which other symptoms which are more crucial you should know? The what are the four classic feature of Parkinson disease? We talk from the motor standpoint. Parkinson disease is characterized as a syndrome usually known as Parkinsonism. All right, it have a four cardinal signs. We are talking about bradykinesia. We're talking about rest tremor. We're talking about rigidity. We're talking about postural and gait impairment. All right, all these features are there. Mostly, this Parkinson disorder occurs in elderly people, people above. Let me say, like, 70 years or above, all right, because they will be having this kind of tremor, like you see the way my hand is shaking. Like if you meet your grandma and you ask your grandma to give you something, she's trying to give you and her hand is shaking, the tremor is there, something like that. And if they are walking, there's a term, there is a abnormal gait which Parkinson disease have. We call that match petty gait. Realize they are shaking and they are walking. All right, guys, this is just the, I want to make it brief, all right. I don't want to go too much deep and start explaining a lot of concepts. It is so boring, all right. So, what are the treatments there? Up till now, there is no adequate treatment for Parkinson disease, but the medicines can be given. The medicines would only helps in replacing, either they are replacing dopamine or they are fighting the underlying disorders. What are the underlying disorders? I just explained that you'll be having underlying disorders such as increased heart rate, increased blood pressure. You know, some medicines are there for those aspects. You will be having breathlessness. Some medicine will try to take care of that. You will be having rigidity and etc. Those ones you might not have enough medication for that, but there is something we talk replacement of dopamine. Like there is a term for that. I'm not going into it. All right, replacement of dopamine or something. All right, if there is a dopamine insufficiency, so we can use that treatment as well. All right. So the major treatments, if you're having your grandparents having Parkinson disease or whatever, and you're so scared, don't be scared. Just do one thing: take them to the hospital, and they will be admitted to the physiotherapy. Me, I'm a physiotherapy, so we handle such cases. We try to train their gaits. We try to assess them nicely, and we try to help them in breathing exercise and etc. in all daily functional activities, so that they will be able to meet up to the expectation of all daily function. You don't have to be worried, but it requires a lot of training for them to undergo this, whereas they can be getting some medications which will be helping them in their functional activities. So this is it. That is the brief I can go for now. Thank you for watching, guys. As usual, have a very nice day. Please, guys, I'm having less subscribers. Please hit the subscribe button and subscribe for me. And another thing, clicking the like button, please. I need that like. Thank you for watching. Have a very nice day.